Hello, everybody. This is Dr. Srividya Iyer. On behalf of the Hindu Temple Society of North America, New York, I welcome all of you on Facebook and YouTube to today's health and wellness session on the pandemic. It's third of our series, and today we focus on the COVID-19 vaccine facts and rumors. We have with us today Dr. Madhuri Ray, who's currently with the New York City Department of Health and Mental Hygiene, and her work is at the intersection of medicine, health equity, and public health in the New York City Department's fight against COVID-19. She's the contact tracing clinical epidemiology contact lead at the New York City Department. Dr. Ray is an MD from the Drexel University College of Medicine and is trained in general surgery at the Massachusetts General Hospital and the University of California in Los Angeles. She also has a master's in public health from the Harvard Chan School in Public Global Health with a concentration in humanitarian ethics and human rights. We welcome you, Dr. Madhuri Ray. It's a pleasure for us, and thank you for your time for doing today's session. I would also like to mention that if you have any questions, please post it on Facebook and YouTube, and we'll take it if time permits. Over to you, Dr. Ray.
Thank you so much, everyone, for having me. I want to apologize right now if there's any background noise. I'm actually in one of the vaccine hubs where I am the leader of the vaccination unit. So I'm happy to be able to join you today, and also want to thank my colleagues who were nice enough to set up a special room for me. And so today I'm going to go through a slide deck, which I think will answer many of your questions. But additionally, I think I would really like to leave time for you to ask me questions. And as you'll see, and as I'll mention in the presentation, there are a lot of reasons for people to have low confidence in vaccines, and there at least in my opinion, in my perspective, there are more reasons to be confident in the vaccines and to want the vaccines. And of course, that's why I do this work. But the only way to understand different points of view is to have a conversation. And so even though we have some slides, I'm really trying to approach this as a conversation with you. I'm also going to talk a little bit about, what this virus means for South Asians, rather than just for, the general New York City context. And can you advance the slide, please? So I'm first just gonna start with where we are. And there we go. So on the slide, there are two graphs. So the first graph shows the number of new cases every day from COVID for the whole of New York City. And it shows us a lot of things that we already know. We know that in March and April, New York City was, really, really heavily impacted by COVID, to the point that, our healthcare systems were overwhelmed. Doctors were forced to do things that they would never do in normal times because the healthcare system was so overwhelmed. And then you can see that it was controlled, but the cases did come back up. And while they are decreasing now, they're still very, very high in New York City. And I get a lot of questions that says, New York City especially, but really all over the country, people were coming together during the pandemic. They were making sure they wore their face coverings. They were foregoing visits to family members who were at risk. They weren't traveling. They weren't, they were staying 6 feet apart, not going to all the events that, all over are very important in New York City. It's part of the reason that people live here. And everybody really came together as a community to do all of those things to help control the virus. And it worked. It worked, right? You can see that in April, the cases started to go down, and that they went down very quickly to a level that was very manageable. I get a lot of questions about, well, if we did all of these things, why did the virus come back up? Why do we still have COVID if all of these things are so effective? And the thing is that this virus is very powerful, right? This virus is very, this isn't like other viruses where just doing those measures is going to be enough to really totally control the virus. And because of that, as we're going to talk about today, to control the virus, to get to a point where we're not going back to these ups and downs, we need to both do all of these things that we're able to keep the virus at a manageable level, to keep the virus from overwhelming healthcare systems again. We're gonna have to do all of that plus the vaccine, if we're ever going to get to a time, before last March. And then I wanted to also point out, we have another map here next to this graph, which talks about 7-day percent positivity. And I'm happy to answer questions about that, but percent positivity is part of the way that we measure the transmission of the virus, right? How actively transmission is happening. And the point of this map, as you will see in many of the other maps, is that, of course, the colors are not all the same in every neighborhood. And so we can talk about the number of new cases in New York City, we can talk about them being low or high, but whatever story we tell about the whole of New York City may not be the story of one neighborhood, right? And there are different impacts of COVID across different communities. And can you advance the slide, please? So this is something that, I always say that defeating this virus, controlling the transmission, these are not activities that, the healthcare system can do alone, that the government can do alone, that the private sector can do alone, or that communities can do alone. This is something that we all, as a community, as people, within our smaller communities and within the bigger communities, even of people who live in the United States, right? Within the communities of South Asians, within the community of all Asians. This is something where we all have to work together, because for this virus, the worst impacted people are, we're not going to be free of the virus until the worst impacted people are free of the virus, until their situation improves. And so we are thinking about equity first, right? We're thinking about the structures and the history that are built into this country that lead to people having, better or worse outcomes, better or worse health outcomes. And that is just our first thought in the approach. And we believe that that has to be everybody's first thought in any approach to ending the pandemic. And can you advance the slide, please? So to date, I gave you a little hint of the conversation that vaccines are very critical to defeating this virus, and they are, very, very, very critical to us returning to something closer to the life that we used to live. And so in terms of the whole United States, our progress is that we have given a vaccine, at least one vaccine, to over 140 million people. As we'll talk about, some vaccines require 2 doses, some require 1 dose, but we are at 50 million people in the United States that are fully vaccinated. Similarly, in New York City, which has a population of between 6 and 8 million total, and of course only a subset of those are eligible and adults. But we have vaccinated almost 4 million people, and fully vaccinated, so meaning people who are likely immune to getting sick from the virus, is almost 1.5 million New Yorkers. And can you advance the slide, please? And of course, as I just told you, giving those numbers for New York City, giving those numbers for the United States are encouraging, but of course that isn't the whole story. That's just the first part of the story. And here we have a map where the different colors of blue represent the relative population that has received at least 1 dose of the vaccine. And you can see again that it is not equal around the city. Similarly, you can also look at race, which is a race or ethnicity, which is also something where we've seen a lot of inequality among both the COVID impact and the uptake of vaccination. And what the data show us is that often the people who need it the most, those who were impacted the most, are also the ones that it's hardest to get the vaccine to. And they're the ones that are taking less and less of a proportion of the vaccine. Now, you may notice on this graph, and you may have heard in other data reports about race and ethnicity in COVID, that Asians, are kind of in the middle, or their impact is better. And I want to talk specifically, to the people listening today about what that means and what the impact of COVID is on people who are South Asian, on people in Asian communities all over. And something that I think everyone on this call knows is that, of course, Asians the group Asian represents many, many, many different communities, right? And, South Asian is one subset of those communities, but even within South Asian communities, there is a huge diversity. Among the Asian race group, we have the biggest and most dramatic, wealth gap between the highest and the poorest. And just in terms of what people face and, how their lives are, there's a huge diversity. Additionally, many Asians in the United States are themselves or have family members or neighbors or people in their networks who are not citizens or who are recent immigrants. And our systems for collecting health data on people who are underdocumented or people who are just afraid related to their documentation having gone through a process for citizenship are hard to get health data on. And the point that I want to make with that is that, data are telling us that Asian communities are not that badly off in terms of COVID, that Asian communities were not heavily impacted by COVID. And, that's something that as we get more data, as we learn more and more, we think that is actually completely untrue. There are some particular, what happens is that when you have well-off and well-to-do persons who have great healthcare access and have great trust in healthcare systems who are Asians, that actually, when you combine them with other populations that have less access or have more of an impact of COVID, that it masks what is really going on. There are specific studies looking at South Asians that have tried to estimate the impact of COVID on South Asians. And what those find more and more is that South Asians have high rates of hospitalization. If you look at the UK has done a lot of work on this, where South Asians, are having worse outcomes from COVID. They are getting hospitalized more, they are dying more. And, we know that it is possible, and actually more and more, we are seeing reinfection with COVID. And so it's just a way to remind everyone that COVID is serious in South Asian communities, in Hindu communities. And also that, the vaccine is important, and it's going to be doubly bad, right? If the same people who are at the highest risk from COVID, who are at the highest risk from getting COVID, are also the people who are resistant to taking the vaccine. And can you advance the slide, please? So now I'm just going to talk a little bit about how the vaccines were developed. A lot of questions I get come around this process. How was the vaccine developed? How did we get the vaccine out in such a short period of time? What is the science behind the vaccines? So in terms of the development of vaccines, so, it's very encouraging to me as someone who's worked in global health, who's worked in public health. It's both encouraging and discouraging to me that this vaccine, like such great vaccines, such effective vaccines, and such novel vaccines could be produced in such a short period of time. And it is encouraging to me because, of course, the vaccine is critical, and it's really going to make a difference in terms of lives saved and really the way we live our lives. But it's discouraging because it just shows what we could do if we put the time, the resources, and attention that we needed to put into public health. So in terms of the development of the COVID-19 vaccines that are available now, scientists have built on years of research from other vaccines. And very often in scientific communities and pharmaceutical companies, there is sort of isolation. There is a drive to get, your intellectual property published or to own it as much as possible. And that was something that we just could not afford to do as human beings in this pandemic. And so the collaboration that we've seen in COVID is really unprecedented, and that just sped up innovation so much. Of course, resources, the lab resources, the funding for vaccines was, something that we haven't seen ever before in public health initiatives. And so it really just goes to show you that paying attention to public health and a budget can actually change public health outcomes, and that funding is often the limiting resource on how fast and how well public health treatments are produced. Of course, companies were less concerned about making profits, and so we saw companies take losses. We saw companies that instead of waiting to get all of their approval and then start producing something and then marketing for it and then distributing for it, the pharmaceutical companies just did everything at the same time. And of course, if the vaccines weren't found to be effective enough or safe enough, those vaccines were just thrown out, and that whole factory that they produced was no longer useful to that particular company. And that's something we saw with the company Merck. And so that less profit-centered model is a reason we got vaccines out quickly. And similarly, of course, in terms of the cooperation, we've seen governmental cooperation that we don't see day to day in order to, to distribute the vaccine, which is some of the most difficult situations. For example, the site I am in now, we've been planning for this site since the beginning of the pandemic. And can you advance the slide, please? So in terms of the clinical trials, there was no speed up, there was no shortcut in the clinical trials. So every medicine, every vaccine, every treatment that is approved in the United States has 3 phases of studies. Basically, phase 1 is very small. You're making sure that the treatment isn't actually harmful and doesn't have, really dangerous side effects. Once you've done that, then you have phase 2 to just be, be pretty sure that it's effective, and again, keep track of that it's not hurting anyone. Phase 3 trials are the trials you hear the most about, and those trials have tens of thousands of people. They are very scientifically sound, and those phase 3 trials for any medicine, before COVID, during COVID, after COVID, those trials have to be completed according to certain standards. After that, the medicine is authorized. Then once the medicine is authorized, of course, there is a lot of monitoring that happens, just to continue to collect data. But emergency use, regular use, any medicine goes through through this process, and our vaccines have gone through this process as well. Now, there is something called an emergency use authorization, and that is what we've done with COVID, because we haven't done all the testing. We haven't found maybe all the benefits of COVID. We haven't proven that they have benefits, for example, in eliminating transmission of disease. But once we knew they saved lives, we cut through the bureaucracy, we cut through the red tape, and got them out to people because the demand or the impact was so high. And can you advance the slide, please? So, of course, there are 3 COVID vaccines available in the United States. The Pfizer BioNTech mRNA vaccine, the Moderna mRNA vaccine, and the Johnson & Johnson Adenovirus Vector vaccine. And I'm just going to tell you a little bit about how they work. Advance the slide, please, sorry. So These two vaccines work in essentially the same way. So I'm going to talk about the mRNA first, and then I'm going to talk about how the adenovirus vector vaccines are different. So what we do with the mRNA vaccine is we take a blueprint for a small piece of the protein, or of protein from the virus, right? It is just one piece of it. And we take basically the instructions on how to build that one piece of it. We put that in a glob of fat so that it can enter your cells. It enters your cells, and your body's own machinery produces just that protein. Very shortly afterward, a small amount of that protein is produced, and then the blueprints themselves just, dissolve on their own. But that way, your body learns to recognize that protein. And so when the body sees the virus in the future, it'll recognize it because that virus has the same protein. Now, the reason this technology is really great is because there is no virus. Viruses are living things, and there is no virus in this vaccine. I talk about it as if you've never met me, right? But somebody asked you to come find me, and they told you I was wearing a purple hat, right? If I'm in that restaurant wearing a purple hat, even if you've never seen me before, you can find me because of that purple hat. But I am not the hat, right? The hat is something, you can use to recognize me, but it's not me. It's not a living thing. It's not, a being. And so what this virus is doing, it's basically telling your body to produce a couple of purple hats so it knows what purple hats look like. And then when it recognizes someone, when it sees someone wearing that purple hat, it has a well-planned, well-structured attack strategy. And can you advance the slide, please? The adenovirus vector vaccine technology is very, very similar. It uses the same thing. It's making purple hats, but instead of using a glob of fat as the casing to get that blueprint into the cell, it uses the shell of a virus, right? It takes a virus that can't replicate, right? It can't make more viruses. The virus itself isn't really harmful to human beings, but it just takes sort of the outside body of that virus. The bodies of viruses are created to get genetic material into a cell. And so it takes that and uses it to enter the cell. And so some of the adenovirus vector technologies, that body, that shell of the virus is, very effective at getting into a cell. The fat blobs, not so much. And so for the vaccines that are available in the United States right now, you'll see that the mRNA vaccine requires a little bit of extra time. It requires a little bit of studying on the part of the body to really learn what that protein is. With the adenovirus vector technology, you actually, the body learns well enough from just one dose how to combat the virus, or how to recognize and combat the virus. And can you advance the slide, please? So the COVID vaccines, this slide shows a lot of numbers. And what it's showing is really that there were a huge number of participants in each of the studies for each of these different vaccines, and that the vaccines were specifically tested in different groups. They were specifically tested in Asian populations. They were specifically tested in persons 65 and older, and found to be incredibly safe and also incredibly effective at keeping people from getting sick. And can you advance the slide, please? So what did we learn from those trials? So like I said, safe and effective for everyone, for many different groups. There were no deaths from this vaccine. And of course, all three of the vaccines are very effective at keeping you from getting sick from COVID-19. So keeping a person who gets the vaccine from going to the hospital and from even dying. Now, what we don't know about the vaccines is whether they keep you, that's the next slide, but I will just also mention, you may have heard about variants, happy to answer questions about those. But in terms of the variants that you may have heard about, all 3 vaccines, based on all the studies done so far, are effective also against different mutations, different kinds of COVID-19. And advance the slide, please. So what we don't know, we know the vaccine will keep you from getting sick if you get the vaccine. We don't know how long it'll keep you from getting sick. We don't know whether you might need a booster or an additional shot. We don't know how the vaccines work in children because it wasn't studied in children. And we don't know, and although studies are being done in children right now, when the studies were done, right, because the vaccines are proven and were proven in those clinical trials to save lives, they didn't wait to release the vaccine before doing more trials to prove how well it prevents a person who's vaccinated from spreading the virus to others. And so it is entirely possible that if you are a person who gets the vaccine, you no longer spread the virus to others. However, we haven't proven it yet. And so, if something that, as an individual, for me, for example, for my family members who are older or who have underlying conditions, I'm not going to take the risk on something that isn't proven. And that's part of the reason that we ask you to continue to wear face coverings and continue to maintain physical distancing when, even if you are fully vaccinated. Now, the data that we have definitely shows that transmission is very much decreased if you get the vaccine. And so that is a big advantage of the vaccine. But again, we still don't know 100% how much the transmission is decreased. And can you advance the slide, please? So, I think we've talked a little bit about the benefits of vaccination, but why get vaccinated? So, of course, safe and effective. I keep saying that vaccines are safe and effective because I really want you to understand, if you understand anything from this talk, then please understand that. The vaccines protect you from getting sick. Now, what I hear, especially from communities that are impacted, from people that are impacted, is, oh, I already had COVID. But we know that you can get COVID again. You can get COVID a second time. And sometimes that second time you get COVID, it is worse. So you do still need to get the vaccine if you have COVID. And myths and misinformation, like the fact that you don't need the vaccine if you had COVID, are really one of those things that work to hurt an individual or a community doubly, right? Or in a multiplicative way. Because not only are people the most likely to get COVID, the most likely to get sick from COVID, but they're also then not taking the vaccine that they are the most in need of. So the other thing I hear is that, oh, I am a young person, so I don't need to get the vaccine. So you have to remember that, the impact of COVID is very large, right? People of all ages have been hospitalized and died. There are several syndromes that we're learning more and more about where young, healthy people with mild illness have had heart inflammation, have been unable, have had syndromes where they're unable to work after they have had COVID. And so it's so important. Similarly, I know that most of the South Asians I know, most of the Hindus I know are very close within families. We care a lot about our family members. And it has been hard for me to be far away from my family for the last year. But with the vaccine, you are more likely to protect the people around you, and we're learning more about that every day. And then, of course, you know, this vaccine in combination with wearing your face covering and maintaining physical distance can actually, as a community, help us move closer. So if we all together, you know, get vaccinated, wear that face covering, maintain the physical distance, if we all together do that, then we might get to a point where COVID-19 is gone and we don't have to worry about COVID-19 anymore. We're far from that now. Right now, the danger from COVID-19 is large and immediate, but you know, this is something that if we work together as a community, that we can potentially win this battle against COVID. And can you advance the slide, please? So I'm going to go very quickly through this. I know there's some people who are not from New York City who are going to be watching, and so this is very specific about getting vaccinated in New York City. And can you advance the slide, please? So states, all over the United States, the states are in charge of determining who is eligible. In New York City, you know, the New York City government does not have a lot of control over that, but what we do have control over is really explaining in detail in New York City context what eligibility means. And for us, eligibility is changing every single week. It's changing, you know, sometimes, you know, a day will go by and you'll be surprised and there's all of a sudden a whole group of new people are eligible. Very soon, almost everybody will be eligible. But right now we have a website, which is nyc.gov/COVID vaccine distribution. That's all one word, where you can look and understand among all the different categories, really like how the eligibility requirements apply to your specific situation. And can you advance the slide, please? So, of course, this eligibility conversation is a temporary thing. The goal is to vaccinate everybody in the United States. And we hope that, you know, in the summer, that will be the case, that everybody is going to get it, that the vaccine is going to be everywhere, like flu vaccines are everywhere. But this is going to take time. We have to build up our supply. We have to ramp up production of the vaccine before that can happen. If you are not eligible at the moment, don't worry. It's not that you're not going to get the vaccine. You will get the vaccine, and it will be soon. Can you advance the slide, please? So very quickly, in terms of vaccine eligibility. So as I mentioned, children less than 16 years of age can't be vaccinated at this time because we haven't done studies on children less than 16 years of age, but for several of the vaccine studies have already begun in this group, and we are hoping to hear more information as soon as next month. Everybody else can be vaccinated. There are a lot of questions, you know, that are related to the way the clinical trials are done, you know, that say if you are pregnant or breastfeeding, for example, can you get the vaccine? If you have diabetes, if you have heart disease, can you get the vaccine? And the answer to every question, except for the one that I spoke of earlier, to every question about underlying medical conditions is yes, you can get the vaccine. And the way that I think about this, and to me the most powerful argument for getting the vaccine, is that you're not comparing the risk of getting the vaccine to the risk of nothing, right? You're comparing the risk of getting the vaccine, which is really almost no risk. It is such a minuscule risk. And, you know, of course, we don't know everything, but, you know, this is just if something we'd never expected would happen, an uncertainty of potential risk. But you're comparing that to the real and very large risk of actually having COVID. And the risk of COVID, especially if you have underlying conditions, is huge. And in my mind, there is no comparison. You know, the COVID risks are so high and COVID has such a big impact and is so deadly. Can you advance the slide, please? So again, in New York City, the steps to getting vaccinated, and these will be similar to steps for getting vaccinated everywhere else, but the first step is to make sure you are eligible using the website I described. The second step is to schedule an appointment. In New York City, you can do that by going to the website vaccinefinder.nyc.gov or calling 877-VAX4-NYC if you don't want to go online. In New York City, you also, and really everyone in New York State has to complete a vaccine form for New York State, which is available electronically. And we have that website there. Also, if you schedule an appointment, you will be pointed to that site to fill out the vaccine form. And then, of course, get vaccinated. You often have to bring proof of eligibility, and when you sign up, you will get some instructions on what that proof of eligibility is. I know that most sites are not, really trying to catch people. The idea is just really, if you have done your best to bring the proof of eligibility, then most sites will trust you to get vaccinated. Also wear a face covering, make sure you have all of your precautions at the site. And then of course, if you got a 2-dose vaccine, you want to make sure you make that appointment for the second dose and make sure you get the second dose. And can you advance the slide, please? Let's just skip this slide for the interest of time and go to the next slide. So the other thing I hear about is side effects and adverse effects. And this really speaks to the point I made earlier about comparing the risk of the vaccine to the risk of COVID. And I think there's a lot of misinformation around the side effects, around what adverse effects exist. So side effects are something that are normal and expected from any medical treatment. And you remember that I told you that for both of the vaccines, the job the vaccine is doing, the purpose of the vaccine is that, it sees that purple hat, it's introduced to that purple hat, but it's really training and learning to build a strategy and a response, to basically raise an army against anything wearing a purple hat. And so in practicing that, right, and in learning it, many people will have side effects. So you'll feel like you're sick because your body is practicing as if you were sick. Often it feels like, people get headache, body aches, tiredness, fever, as if you would feel when you were sick. They really last only a couple of days. Sometimes people who are older don't have any of those side effects at all. But if you do get them, it's a good sign that the vaccine is working. I can tell you that when I got my first dose, I was surprised and I felt so bad, right? I felt ill, I felt like I had a cold, I drank some tea and I was calling into work and saying, I don't know if I can come to work tomorrow, I'm feeling so bad. I went to sleep early, I woke up in the morning and everything was gone. I was completely better. And so, while it's uncomfortable and while it's inconvenient, you're not actually sick when you have those side effects. Because remember, the vaccines don't have any virus in them. They just have a protein, a piece that allows us to recognize the virus. And can you advance the slide, please? So if you do get side effects, as I said, they will be, they are short-lived. If they're not short-lived, if they have trouble breathing, we encourage you to call a healthcare provider because, of course, it is possible before you're immune, right? You can get COVID the day before you get the vaccine. You can even get COVID the day after you get the vaccine while your body is still learning and producing that immunity. And so, if you are sick, you do want to rule out that it's not something else. And the way to do that is to wait a couple of days. If you don't start improving, then that is the time to call your doctor. Even if you have side effects after the first shot, really, unless your doctor specifically tells you, even if you have side effects, you should still get the second shot. Some people even have a better time after the second shot. And, it's, like I said, uncomfortable, but worth it. And can you advance the slide, please? So allergic reactions are what we call adverse effects. They are not side effects. They are not the normal function of the vaccine. And so there have been extremely rare cases of people having severe allergies to something in the vaccine. And I always explain this as, if you are allergic to peanuts, for example, then if you have peanuts, you will have a really severe reaction. But it doesn't mean that anything else, will be an issue. And it doesn't mean that, peanuts in general are horribly unsafe. Similarly, if you have a bad allergy to cats, right, it doesn't mean that everybody in the world should not have a cat. It means that, for you, that's a particular special situation. And so, similarly, people ask a lot, I'm allergic to penicillin, I have, hay fever, spring allergies, I'm allergic to another medicine. And, even if, especially if you've had a serious reaction, I think it's always important to be careful of that. But, that serious reaction to something that's not an ingredient in the vaccine doesn't mean you're going to have an allergic reaction to the vaccine. And given the huge benefit of the vaccine, we still recommend you get it. Sometimes people don't know they're allergic to a component of the vaccine because they haven't been exposed to it before. And just in case, even though they are extremely rare, I don't want to give myself bad luck, but in thousands and thousands, like tens of thousands of patients that I've overseen have not had one get an allergic reaction like this. But just in case, we observe everybody who gets the vaccine, and all of the staff are trained in the equipment used to manage the vaccine, and most of the sites actually have ambulances right at the site, just in the extremely rare case that something happens. If there is a severe allergic reaction, it will happen very shortly after you get the vaccine. And can you advance the slide, please? Just a quick reminder that after vaccination, it does take about 2 weeks, a couple of weeks, once you're fully vaccinated, to develop immunity. We also need to be cautious until we get to that point where, as a community, most of us are vaccinated. That's the point where we will really all be protected. But until we're all protected, meaning almost everybody has the vaccine, then we are not all safe. And you as an individual are not all safe. And so after you get the vaccine, you still have to stay home if you're sick. You still have to stay 6 feet away from others. You still have to wear a face covering. You still have to wash your hands. We are learning more and more about what you can do that's different after you've gotten the vaccine. And, there's new guidance every day, but I'm also happy to talk about that. And can you advance the slide, please? So I think this is my last slide. I just want to leave this with what you can do right now. So of course, continue doing all the things I just mentioned, all the precautions I just mentioned. Remember to take care of your mental health. COVID has a great impact on mental health as well. You can call 188-NYC-WELL, text WELL to 65173, or you can chat online with NYC-WELL if you're in New York City to talk to a counselor 24/7. I'm going to add something here for this conversation. The rise in anti-Asian racism has not, I think South Asians have been seeing this since forever, but also there was a huge uptick after September 11th. And I think that, the anti-Asian racism that is focused on Chinese communities, of course, doesn't stick to Chinese communities and does heavily impact South Asians. So if you are the victim or you witness discrimination or harassment, you should call 311 to report that. There's a whole office dedicated to understanding, managing, and obtaining redress for those complaints. If you see a crime that is because a person is Asian, or you think it's because a person is Asian, you should call 911 just like you would for any crime. But if they think it is a hate crime, or you think it is a hate crime, say that on the call, because hate crimes are treated differently. There is a hate crimes unit, and hate crimes are also tracked. And then for the second piece, if you've learned anything, if you learned anything from this talk, if there's anything that you felt like you had a misconception of that you know better, if there's anything that was interesting to you, please share it, because this is a community effort. And we really need, we can't ignore people who think differently from us. We have to have conversations with them. We have to share our perspectives. And then, of course, if you would like to have someone give a talk for your community or your organization, you can email ics-speakers-bureau@health.nyc.gov. And of course, if you want to share the website, nyc.gov/COVID vaccine, it always has up-to-date information and a lot of good frequently asked questions and just, general new guidance. And I think that's it. So I would love to hear your questions now.
Good afternoon, Dr. Ray, once again. It was such a pleasure really listening to you. And let me tell you right at the outset, our community feels so proud about your accomplishments. I read your CV. It's a real long one, and congratulations. I have several questions.
Thank you so much. And I just want to say that that since I was a little girl, we have been big admirers of the Hindu Temple Society.
Oh, wonderful. Thank you. You should come over sometime, We'll be more than happy to invite you there, okay?
Of course.
Yes. Are you from New York originally?
I'm not from New York. We lived all over when I was a little girl, but we definitely lived in New Jersey for a while. And my parents live in Pennsylvania now, but they come visit sometimes.
Wonderful. Congratulations again. It's good to see our young doctors, do so well. But my question to you would be, you're a general surgery your background is surgery. I was just wondering, how did you get into epidemiology, and public health? It's really a service-oriented subspecialty in medical field. So I was just wondering if you could just shed some light a few seconds.
Yeah, of course. And so I think I also, before I went to medical school, I did a Fulbright in public health in Ukraine during the Orange Revolution. And so I've always had both interests, and there's actually a growing, surgery is a very important field in global health. And so my first interest was actually in global health. But I can tell you that as I was, surgery is a very long training. And as I was doing the training, I started noticing that, for me, we would do these very, very complex surgeries, and then we would send patients back out into the same thing that caused all the problems. And so it was just fixing things one by one, and spending all of your life and all of your energy, focused on patients, and then not being able to address sort of the root causes of what was causing their illness. I do miss the technical parts of surgery, but there are different, you have to balance, right? And for me, the most satisfying thing is sort of attacking the roots of problems.
Appreciate that insight. Now, I hope you don't mind going over 5 minutes, because I have several questions from the listeners. Hopefully they get, and it might sound like a repetition. You may have answered the questions during your presentation, but bear with us and they'll be happy to hear the answer from you directly. Okay, so I'll start with a random question. Can pregnant women and the mothers who are breastfeeding get the COVID vaccine?
That's a great question. And actually, even if the questions sound repetitive, this is not a lecture, it's a conversation. And so I'm happy to stay late to hear all of them. So
Indeed. Thank you.
But yeah, so pregnant women and women who are breastfeeding weren't in the initial tests, because it basically takes a long time, and there's a lot more precautions you have to take. And the goal of the phase 3 tests was to test the largest number of people possible. Now, that being said, again, we're comparing the risk of the vaccine to the risk of actually getting COVID. And there isn't even a theoretical risk in pregnancy or in breastfeeding from the COVID vaccine. Because remember, it's only a small amount of the protein that your body is fighting against. And the protein doesn't do anything on its own except teach your body how to fight the virus. We have found also that, many people got pregnant during, just sort of happened to get pregnant during the course of the study or around the time of the vaccine. I know many pregnant healthcare workers who were eager to get the vaccine, and we haven't seen anything associated with pregnancy or breastfeeding as an outcome. So that is not a controlled study, but it is data. On the other hand, with COVID, we know more and more that there is a bad impact of COVID for both the mother and the fetus if you get COVID during pregnancy. Similarly, during breastfeeding, it's not the same level of impact, but of course, anybody is at a huge risk if they get COVID. COVID is, even though more controlled, it is running rampant across the United States, and you are at a very high risk just from living in the United States of getting COVID. So the American College of Obstetrics and Gynecology, the WHO, and the CDC, the New York City Health Department, all are in favor of the vaccine during pregnancy and breastfeeding. And actually more and more studies are coming out that if if the mother gets the vaccine, that those antibodies are often transmitted to a newborn or transmitted through breast milk, and actually offer babies, who are themselves at risk of COVID under 1 year old, actually give the babies some level of immunity that they can't produce on their own.
So you would recommend that they take the vaccine?
Absolutely, yes.
Great. Now, what is the number of patients in the state of New York that have been exposed to the different variants we were talking about of the COVID virus, coronavirus, I should say?
Yeah, so I can just speak a little bit to what variants are. So
yeah.
Every living being, right, has genetic material and reproduces that genetic material either within their own body to make new cells or replenish the body, or when they reproduce for offspring, right? And every time that genetic material is copied, sometimes random errors come in to the copying. And human beings have a lot of mechanisms to proofread, right? So if an error happens, it's read over and fixed before it gets put into a new cell or a new human being. Viruses don't have that level of proofreading. And, the coronavirus is actually better than most viruses in terms of the proofreading mechanisms it has. But what happens is you're going to have those mistakes. And sometimes as those mistakes happen, they will randomly give the virus an advantage, right? They might make it easier for the virus to avoid the immune system, or they might make it easier for the virus to get into a cell, for example. And so some of those variants have emerged, and some of them are in New York City. So far, all the vaccines have been tested against those variants and seem to be effective against those variants. It doesn't really change the way the virus is transmitted, right? So we have the vaccines that are effective, but if you are standing 6 feet away from someone, no matter how good it is at getting into your cell, if it doesn't get to your cell, you're not going to get the virus. And so while all of those other measures we said are not 100% effective, they're still quite effective. In terms of finding the variants, that's actually a little bit more complicated. You have to do something called whole genome sequencing, which was ironically created in America. And, one of the pioneers was at the Broad Institute and now is the scientific advisor to the president. But we don't do a whole lot of it. They do much, much more of it in Europe. And so what we're trying to do is we're trying to ramp up our whole genome sequencing to get really a full and better picture of what's happening. New York City, I believe, is doing more whole genome sequencing of COVID than any other place. But we're still doing an extremely small percentage. I believe it's 1%, but I don't have the exact number off the top of my head, but it's just a couple of thousand cases that we've done the sequencing on to find the variants. So we have a full variant report on our website, which is nyc.gov/health/coronavirus. It's updated about every week. And we can tell you, I can tell you the number of, variant 1 or variant 2 that is produced, and that's written in the report. But you have to remember, whatever we find is just a small tip of the iceberg at this point.
Thank you so much. But it's good to know, it's really encouraging that the vaccines we're receiving are actually effective among the variants, right? They should be effective for all the variants so far, right?
As far as we know so far, it is highly effective. The other thing is that if we do happen to come up with a variant that the vaccines are not effective against, it's not like we have to start over from scratch. Remember, I told you these are small proofreading errors, and so we know how to produce the basic vaccine. It's just a matter of tweaking that production, and that's something that can happen very quickly. I think Moderna and Pfizer are already looking into it now. I guess I'll make one other point, which is that, I told you these are random mutations. So if something happens, let's say 1 every 1,000 times the virus reproduces, the only way to decrease the number of variants and decrease the emergence of potentially, vaccine-resistant variants, the only way to do that is to decrease transmission.
See, it's important to know because a lot of my patients, when I tell them you must get the vaccine, there's not even a question about it. They keep saying, oh, but what about the variants? I'm going to get this UK variant, the South African variant. You can't really argue sometimes when they do not want to get the vaccine. But I see it is getting better. And while we're talking about the variants, can you also tell me the difference between of course, the Moderna and the 2 shots from the Pfizer versus the Johnson? Because they feel that a lot, again, this is from the patient population that I come across. They say, oh, it is so convenient. I'm waiting for the Johnson one. But I said, you're at risk now. You should go for whatever is available. And I think they're looking for the convenience. Do you really think that Johnson, I know it's they quote 75 to 76% effective. And if this really compromises the convenience to take a Pfizer or a Moderna, because, you can hear so many different aspects from the patients in real life. They're so different. Yeah.
So I think in terms of the side effects, in terms of the experience, there isn't really a difference. And in terms of the effectiveness, you have to remember that, these effectiveness numbers are impacted. So even if a vaccine is highly effective against the virus, and let's say it's 95% effective against the variants we're used to, and then a variant comes up and it's 85% effective, right? Both of those numbers are highly effective. They're almost, in terms of what we experience in terms of their effectiveness, it's almost the same thing. The Johnson & Johnson vaccine was tested in the context of all these variants. So it was tested in South Africa at the time that we knew about the South African variant. It was tested in the UK at the time we knew about the UK variant. And so if it has a decreased overall effectiveness, you just can't compare that one-on-one to Moderna or one-on-one to Pfizer. And there's some evidence that you do get, some people get some immunity after the first shot. Right now, the recommendation from the ACIP, which I have now forgotten what it stands for, but it's the national body in the CDC overseeing all immunizations. The guidance says get whichever shot you can as quickly as you can, because they are all so good that you just want to get whichever you can get first. And then, of course, we may refine those guidelines once all the vaccines are available everywhere. I think the Johnson & Johnson vaccines are really being used. the transport and the storage of Johnson & Johnson vaccines is significantly easier than Moderna and Pfizer. And so right now, much of the Johnson & Johnson supply is being used, for communities and for people who are really going to have issues coming to a vaccine site. And so if you are not among those populations and you can come to a vaccine site, you are doing yourself a disservice if you just wait for the Johnson & Johnson supply to increase when there's available vaccine of another type.
Exactly. And I hear that homebound patients are also, the fire department is giving the Johnson vaccine.
Yeah, so and that link, that information is on our website, but if you are a person who is homebound, who of course has not gotten any, if you've gotten the first dose of another vaccine, you are not eligible, but homebound persons who are in need, who need to be vaccinated can sign up on our website, and they'll be evaluated for eligibility.
Great. So a bunch of few questions, maybe you can pick and choose the way you feel comfortable. In the interest of time, of course. What is the appropriate time to get a booster dose? I'm not sure if you know the answer yet. And in your judgment, how often do you think we will be getting this vaccine in the future? Is it annual, 6 months? This is all about booster dose. And I guess then we go to the next group. What age group of children should be advised to get this vaccine? And I think you've answered that. What are the most common side effects after getting COVID-19? You've answered that too. Maybe you could tell me something about the booster dose and if there's any data on seeing if we have to get this vaccine like the flu shot every year, or is it one time and a booster dose enough? Do you have any info on that?
So we don't know that answer. We know that when you naturally get COVID or, other coronaviruses that are in the same family as COVID, that your immunity doesn't last forever. And that some people, their immunity just kind of fades away. We don't have a great way of measuring immunity. We can measure specific antibodies after the vaccine, but, we know from measuring antibodies to natural COVID infections that sometimes there are other kinds of immunity that are much harder to measure, that are the important pieces of immunity for some people. And so we don't really have a way of knowing at this point, and the vaccine is new. So we're just going to have to, I think we're just going to have to wait and see. There are definitely, I think a lot of people make comparisons to the flu and the seasonal flu vaccine that we get every year. I mean, I am hopeful that it is not the same because the flu vaccine, the seasonal flu mutates very quickly. It doesn't have any of those proofreading capabilities that I talked about. So this virus mutates much, much slower than a seasonal flu. If we, like I said, if we all get vaccinated, if we all, together in the United States and really all over the world are able to get vaccinated, if we all maintain those precautions, there's a possibility that we could reach something called herd immunity. And we really don't know what that looks like. We know that it is easier to reach it if everybody keeps wearing their mask and maintaining distance and following the rules. But the way herd immunity works, right, is that if I have the virus and I am in contact with 5 other people, I can give those 5 people the virus, and then each of them can give 5 people the virus, and the virus can the transmission explodes after that. Now, if I am vaccinated and let's say I'm vaccinated and following the rules, everything, let's say that just following the rules keeps it to 2 people. And then let's say that vaccination reduces transmission of the virus, and that reduces it to 1 person, right? But then, if that 1 person has gotten the vaccine, then the virus has nowhere to go, and that chain of transmission is dead. And the same thing happens throughout, those chains, that chain that might be, 10 people long, and then there are, thousands and thousands. I think at that point it's probably millions. I haven't calculated it, but At that point, you know, it keeps going and it gets very hard to track all the different places that the virus is popping up. But if you can get it very quickly, if you can get it with that first person, the virus is just gone, you know, and it's, once the virus is gone, there's no, it doesn't live in the water or anything, so we can't get it back. And so that is, if we get to that part, if we get to that place, then, you know, boosters might not be necessary. But if the virus continues its high rate of transmission, you know, it's kind of a race between every time the virus goes to another person, it's a chance of another variant coming up that is more effective and can escape our vaccine immunity.
So pretty elaborate answers. Thank you so much. You know, you have a lot of patience, Dr. Ray. So how long, I mean, I'll just rush through some, again, I'll take a bunch of questions. How long does protection from a COVID-19 vaccine last? I think you've kind of answered that partly. Do I need to wear a mask and avoid close contact with others if I have the 2 doses of the vaccine? Again, I think that was partly answered. How many days after the COVID infection is it safe to get the COVID vaccine?
So that is a great question. Having COVID does not prevent you from getting the COVID vaccine, and in fact, you still need to get the COVID vaccine. The most important thing is that we don't want you to come to a vaccine site while you're still contagious, because of course, everybody at the vaccine site is not immune yet. It takes 2 weeks after you've completed the series to develop full immunity. And so of course, if you're at the vaccine site, it means you're not fully immune. And so you could infect somebody who's at risk of getting very sick if you come then. So we ask you to wait for 10 days from when you developed symptoms, or if you didn't have any symptoms of COVID, 10 days from your positive test. And then you also have to be fever-free for 24 hours. And if you had symptoms, they have to be improving. So all those things have to be true for you to be able to come to the site, you know, for us to be sure you're not contagious. There is one sort of exception to that. Some people with underlying medical conditions or people who are older who had COVID and got sick from it, had symptoms from it, received a treatment called convalescent plasma or monoclonal antibodies. So if you've received any antibody treatments for COVID, then you have to wait 90 days until you get your vaccine.
Okay, so it's different for the COVID disease itself rather than the monoclonal antibodies. It's much of a longer wait, 90 days.
Yes.
Okay. And can I travel after I'm fully vaccinated is the question.
Sorry?
Can I travel after I'm fully vaccinated? I guess you kind of answered partly with, you know, safety precautions and all, but I think if you want to go to India, let's say, for a wedding or for something, are you feeling safe or would you recommend that?
So we still do not recommend that. At this point, the US guidance is that and the CDC does not recommend that you travel, even if you have been vaccinated. I think we're learning more and more every day. And of course, all of the travel guidance about getting tests, et cetera, before you come back to the US, you have to follow all the guidance, vaccinated or not vaccinated. Now, you know, domestic travel, some states have changed their guidance. For example, New York State has changed its guidance around people who are fully vaccinated and has really broadened the ability to travel. So I think that's something that we just have to wait to learn more about.
So obviously it's not that safe. You know, people are doing and taking a risk, correct?
Yeah, you're definitely taking a risk, and especially if, you know, you or any of the people who you are visiting in India, you know, if you have family who's older or family, you know, among us South Asians, you know, we get a lot of diabetes, we have a lot of heart disease, a lot of high blood pressure. You know, obesity is different in South Asians, and so you may not appear obese and your weight may not be that high, but you can still have a good amount of fat that you keep in the central part of your body, and that can still put you at higher risk if you get COVID. So I think it's, in terms of weighing the risks and benefits, it's always an individual decision, but something like an international flight and that like 20 hours, or if you're going from plane to plane, you are putting yourself at significantly more risk until we learn more about the vaccine.
Is it more risky to be in the flight itself or the whole travel plan, coming across people and not wearing the mask and stuff like that? Which is more serious?
I think it's hard to say. I think that planes have implemented a lot of guidance about, they've implemented a lot of strategies to keep people far apart from each other. And it's really a matter of, how well you're maintaining those strategies, how well, the plane does have limited ability for ventilation. I would say, if I had to guess, I would say if the airline follows all the rules, I would say probably within the airport, just because you have so many people rushing from one place to another and, maybe not adhering to the guidelines. And it's much more difficult to control people who are moving around in terms of wearing their masks correctly or, pulling the mask up over their nose and things like that.
Can I substitute other mRNA vaccines if I got Moderna or Pfizer for the second shot?
No, you have to get the same vaccine for both doses. And you also, in New York State, you are supposed to go get the vaccine from the same site if you have a 2-dose vaccine, but you cannot mix and match for now.
Change.
Yeah.
If I didn't get any side effects after getting the vaccine, should I check my antibodies for spike protein?
You can do that. Certain antibody tests will work against, certain antibody tests will detect antibodies you form against the virus, but the kind of immunity that you have that produces antibodies isn't the whole immunity you have against the virus. So, we found from natural infection, having antibodies doesn't necessarily mean you're not going to get infected again, and having no antibodies doesn't mean that you're susceptible to the virus. And so, if you have a good amount of antibodies, then it's a good sign that the vaccine worked, but it's not, I think it's not definitive.
It's not telling the whole story. Okay. Mm-hmm. So patients with history of Guillain-Barré syndrome and Bell's palsy, can they get COVID vaccine?
So some people who have received the vaccine have gotten Guillain-Barré or Bell's palsy, but you have to remember that, people are just people when they get the vaccine. And sometimes if you get a room of 1,000 people, if you get a room of 100,000 people, and you just watch them, some people are going to develop Guillain-Barré and some people are going to develop Bell's palsy. There's also been a lot of conversation around clotting, and the same thing. If you take this group of 100,000 people, some of them are going to develop blood clots. And so right now, based on the knowledge we have so far, the incidence of Guillain-Barré or Bell's palsy are, not higher than they would be if we watched the same number of people and they didn't get the vaccine. So we don't think that there's any causal relationship. And there has been for other vaccines. I also want to say that those vaccines, these are kind of new models of vaccines. And so many of the ways that they work are different than the vaccines that were closely associated with Guillain-Barré or Bell's palsy.
See, what happens, the media makes it, they exaggerate on the negativity of it. And one case of something would be really repeated the whole day. And patients are and general population, I think it affects their mind that 99% of the time the vaccine is so safe, but yet, they hang on to that one complication that someone had. So. Exactly.
And I think it's the same thing with this comparison, right? Like, are you comparing the vaccine to nothing or are you comparing the vaccine to COVID? And you have to think about it realistically, right? You have to think about it in terms of the actual danger that you're going to face as an individual. And, it's an individual decision all the time, but you do want to think about it realistically.
Yep. Well, I think you answered this question 90 days after the monoclonal antibodies. That's done. And I think another area we didn't touch, if patients are on chemotherapy or immunosuppressive drugs, can they be vaccinated?
So you can be vaccinated. The risk is not there. There isn't a risk of worse side effects or anything. The risk is that you might not have the same strength of an immune response. And of course, we know even less about how long that immunity lasts or how strong it is because those patients were not included in the studies. I would say to everyone to talk to their provider about it. Honestly, every provider I know has said, get the vaccine.
Yes.
Sometimes, though, they might hold your medication for a period around when you get the vaccine or something like that.
So just another minute or two, if you don't mind. I think I have a bunch of questions that we can sum up quickly. Where should I report the adverse events from the COVID-19 vaccine? And are they covered by the National Vaccine Injury Compensation Board?
I believe they are covered if they find that it is associated with the vaccine. So there is a very rigorous vaccine adverse events reporting system in the US. There's an app that you can download called vSafe. And you can ask about that when you get your vaccine, but you can use that app to report your own adverse events, or you can talk to your healthcare provider. I always recommend talking to your healthcare provider if you are concerned about an adverse event. I'll tell you that they are very rigorous in investigating those. There was a story once about somebody got struck by lightning a week after they got the vaccine, and they said, well, this happened around the time the person got the vaccine, so we have to prove that, you know, getting vaccines doesn't cause you to get struck by lightning. And so, you know, I think it's very important to report those.
To report those, okay. In the nursing home patients, I think I kind of thought you did answer part of it. These patients have getting the monoclonal antibodies. They're being checked, you know, every week they swab them. And they also got vaccine, but the swabs keep coming back positive, and recurrent pneumonia. How do you deal with this elderly patients, immunocompromised? I mean, is there any study going on in the elderly patients? And they're back and forth to the hospital, coming back, swabs are never negative, but they got all the recommended treatment.
Yeah, and I think we're getting close to time, so I'll be quick about it. But, you know, for patients who aren't immunocompromised, that even happens in, you know, otherwise healthy patients. And so for most patients, you know, if you're not immunocompromised, we actually don't, that's why we recommend, you know, something like 10 days, you know, and we go by the symptoms and the duration of time. There are studies that show that an otherwise healthy, not immunocompromised patient will stop shedding virus after 10 days if they've not gotten worse, right? If their infection has sort of settled out. And so we actually never recommend a negative test to return to work or anything like that. Now, immunocompromised patients are case by case. And so that's something that we really don't know about. I mean, I have heard really for immunocompromised patients, like people really trying to get a feel for it, but you know, people can test positive months after they stop shedding virus. And so I believe that you know, it's something that each provider has to sort of play by ear, and really, you know, if you feel that somebody no longer has infection or no longer is contagious, then I think the best option is to be conservative, but, you know, and to judge the reality of the situation.
So I think I have the last question, because you did mention specifically about the South Asian community. Do you think they respond differently based on ethnicity and race to the vaccine itself? Do you have any data up to date, or it's still in progress? I guess that's what you mentioned.
So in terms of the bigger race categories, right? So including all Asians together, and we know that there isn't really any evidence that there is some particular physiology that's associated with race. I mean, we don't really, you know, there's more and more evidence that race is not a direct, race is not a real thing. It's a structural category. And so there's no genetic basis to race. However, societally, there's a lot of structural racism built into different policies. And so, especially if, you have brown skin, for example, you're treated differently in this country, and those add up over time. And they add up to, different levels of heart disease, different levels of diabetes, and other different outcomes in terms of overall health. Also, you may not go to the doctor when you initially get COVID, and so that could have a direct impact. In terms of South Asians specifically, like I said, I think that the outcomes are, studies from the UK, studies from other places there are a few studies that are focused, primarily on South Asians, and those those have said, again, a greater impact of COVID, but in terms of vaccines, everything that we've looked at has shown that the vaccines are highly, highly effective in every category.
And just one quick last comment or a question. Do you believe in the immune boosting ingredients in ginger, turmeric, cinnamon, cloves? I think I found some benefit, and I've encouraged my patients to have tea with that. I don't know what your experience. Would you want to include that in your studies? I think it makes a lot of sense.
I think there are more and more studies coming out. I think especially turmeric has definite anti-inflammatory effects, but all of them, I mean, I don't know. I can tell you that, I don't know that any of them will prevent COVID or prevent you, be equivalent to the medical treatments we have. Nobody's tested it, but I can also tell you that, I mean, when I'm sick, I drink all of those in chai. I can tell you what I do.
Yeah, we all do, right? Okay. With that quick comment, unless Shivacharya priest is here, on behalf of the Hindu temple, Dr. Ray, and the Indian community, our heartfelt thanks. I mean, it's unbelievable. What a pleasure it's been listening to you. And again, I must say that we are so proud of your accomplishments. There's Vaidyanath Shivacharya priest. Go ahead.
Thank you, Dr. Madhuri Ray and Dr. Sai for a very useful and fruitful conversation. And I think the whole community has got a lot of points and got clarified. And it's good, the right time we discussed about this. Thank you very much for coming and addressing our community.
Thank you so much for inviting me.
Hope to hear from you soon. Again, maybe we'll have a follow-up lecture on when we have more developments, especially related to the Indian community, right?
Yes, I would be so happy to.
Thank you so much, Dr. Ray.
Thank you.